Hello, this is Dr. Sarah Ahola with the Cattle Health Center. I'm here to give you an overview of the fiscal year 20 Cattle Health Cooperative Agreement instructions and training. And I'm going to advance through the slides here and give you a high-level overview. I will be covering the cattle health goals section within the grants and agreement and guide and go over the guidelines and give an update to our reporting requirements. Please note that the animal disease traceability activities are covered in a separate presentation and section of the guide. So cattle health surveillance and outreach goals, you're going to see things have not changed much from the previous year. It's important to conduct surveillance in domestic cattle and bison with targeted high-risk wildlife populations to maintain national, state, and herd disease status certifications as described in the regulations, standards, and surveillance plans, respond to identified outbreaks in cattle and bison, and conduct outreach efforts to complement the program activities. For specific program guidelines around brucellosis, of course, we have some separate guidelines for Idaho, Montana, and Wyoming within the greater Yellowstone area. We have brucellosis management plans there that cover the surveillance activities, and those must be conducted as outlined in the management plan. Risk-based management plans will be used to implement activities to mitigate risks associated with wildlife. We expect that those states will hold at least one meeting between state livestock officials and wildlife officials. We also will encourage abortion screening in cattle in addition to the other activities around surveillance. Epidemiologic investigations will expect to be conducted and other program activities as appropriate. And then we expect there to be education provided to state, tribal, and federal VMOs, animal health technicians, and AICs around these activities as well. For states that are outside of the greater Yellowstone area, we will expect that education is also provided to state, tribal, and federal VMOs, animal health technicians, and AICs around general brucellosis activities. We will also encourage abortion screening in cattle. This helps us demonstrate that we don't have brucellosis in states beyond the GYA, and support brucellosis epidemiological investigations as necessary. For BSE, we have just some minor edits to the program here. We are expecting to collect samples to achieve state-level goals defined in the BSE National Sampling Plan. Please note that we've added in for non-ambulatory animals, the age is over 30 months, and for fallen stock, which are dead animals, again, we've added in the age of over 30 months for animals that we should be collecting samples from. We expect that the states are conducting outreach and education with accredited veterinarians around the program to encourage sampling, and conduct outreach and education with public health officials and public health laboratories, again, regarding submitting rabies negative submissions to NVSL for BSE surveillance. For the cattle fever tick program, we're not seeing any changes from the previous year. We have guidelines there for Puerto Rico and Texas. Puerto Rico will provide fever tick program data, continue to submit ticks for identification, and collaborate with APHIS and ARS on joint fever tick research. For Texas, we'll continue to conduct targeted surveillance outside the permanent quarantine zone, coordinate hunting and wildlife surveillance with local, state, and federal entities, provide tick submission, again, for identification, continue collaboration with Mexico, collaborate with TPW on white-tailed deer census and fever tick surveillance, and collaborate with APHIS-ARS on joint fever tick research. For tuberculosis, again, no changes from the previous year. We'll expect all states to visit the state-inspected slaughter establishments to validate slaughter inspection, conduct outreach, training, and education with accredited veterinarians to ensure compliance, implement a system to monitor the caudal-fold tuberculin test response rates, conduct epidemiologic investigations as appropriate, and provide travel funds to cover the cost to train new state VMOs for comparative cervical test training, tuberculin training. For states with a bovine tuberculosis detection, we will expect to conduct targeted surveillance in geographic areas where TB has been identified. implement herd management plans and strategies, implement a statewide risk-based management plan, and conduct wildlife surveillance to determine if TB is present in wildlife. For other program activities, again, no changes here. Blood and tissue collection, we will expect the states to assist VS in bringing slaughter plants and all rendering plants into compliance with the blood and tissue collection rule, and in conducting quarterly inspections. Reporting and data entry, we will expect completion of applicable monthly NLRAD NARS reports and to complete data entry into the relevant database systems listed here. For preparedness and response, we will expect to prepare, maintain, and exercise state-level plans, investigate, control, and eliminate emerging endemic zoonotic and foreign animal diseases, and implement appropriate risk-based management plans. This is probably the only real update that is different from the previous year. We are moving towards quarterly reporting for our surveillance data and epidemiologic activities. So states should supply surveillance and outreach data to their AVIC for these program activities that the area office does not already have available. So this will take coordination between the states and the AVICs. The data will be collected on a quarterly basis. Previously, we had been calling out for this data around the time of September in preparation for our annual reporting at USHA. However, given ongoing requests for information, we've decided it would be more appropriate to ask for the data on a quarterly basis, and the AVIC will maintain that information. So the states will simply need to work with the AVIC to update that information, any information that the AVIC does not already have. Data will be submitted through surveillance and activity reports, data that is submitted through surveillance and activity reports may be used to inform decisions about future agreement funding levels. So that's the overview of the agreements plan, or excuse me, the agreements guide with regards to cattle health. If you have any questions or comments, you can direct them to my email that is listed there or through to your AVIC as well. Thank you very much.